One of the most common problems that I address in my office often happens to be the most frustrating problem. That happens to be the problem with heel and arch pain. Probably 20% of my patients come in, they've been to a variety of different doctors, and they're coming to my office because they're frustrated because nobody's able to help them. So let me just review what causes some of the problems with heel pain and why it's so difficult to diagnose, and why people are often very frustrated with the treatments that are involved. Most of the time, heel pain comes from an inflammation or an irritation of the muscles supporting the heel and the arch area. We call that the plantar fascia. And we often get what we call heel pain that starts in the morning when you first put your foot down, and that's our most typical type of heel pain, either plantar fasciitis, where the muscle in the bottom of the foot is very inflamed or irritated, or actually what we call heel spurs, where a small piece of bone is actually sticking out of the heel bone, which is called the calcaneus. This is our typical type of problem that most doctors address. However, there are many other causes of having heel pain. This requires sophisticated equipment that we have in our office, such as a digital x-ray, which can see some of the smallest problems in the bone. We also use our ultrasound, which can pick up tears in the plantar fascia, inflammations in that particular area, or other soft tissue problems that can cause heel and arch pain. However, there are patients that come in that have additional problems, such as a stress fracture or a crack in the heel bone, or even circulation problems that not enough blood is going to the arch or the heel bone, or even neurological problems where they're getting numbness, burning, or tingling, which has been misdiagnosed as having plantar fasciitis or typical heel spur problems. This is diagnosed sometimes with some of the other equipment that we have, whether it's testing it with some of the circulation equipment that we have in our office, or sometimes even using nerve conduction testing, which can pinpoint the problem and be very precise and very specific. By utilizing this type of diagnostic equipment, we can easily pinpoint your problem and then direct you to the proper treatment plan. Some of the treatments may be as simple as utilizing what we call an orthotic, which is a custom device designed for your particular problem to support the weak areas of your foot and let you walk more comfortably, and over a period of several weeks, the problem resolves very nicely, and you could just walk very comfortably in either sneakers or a normal pair of shoes. However, there are times when we require some more intensive work. That may require either some medication, either some physical therapy, or perhaps even an injection. And I would say probably 95% of the patients respond to this very treatment plan. But probably about 5% of the patients that don't respond to this, which may be you, which is why you're frustrated with the lack of relief in your particular foot problem. And so we need to do some of the additional tests, testing the circulation, doing the nerve testing, and following it through with some of the more advanced treatment plans.